Tetanus is an acute infection of the nervous system characterized by spasmodic contractions of voluntary muscles, trismus, and seizure. Tetanus is caused by Clostridium tetani, a ubiquitous anaerobic gram-positive rod with terminal spores. The spores may enter the body through a wound and transform into bacteria which release neurotoxins that reach the spinal cord and the brain stem via retrograde axonal transport through the ventral tract. The toxin then blocks the transmission of inhibitory signals, leading to prolonged, powerful, and painful muscle activity. It is difficult to ascertain the true incidence of tetanus of the newborn in the developing countries, where most of the death occurs prior to issuance of birth certificate. In the majority of the countries in the world, most babies are born at home. In most rural areas and in many urban ones, due to lack of available medical care, these babies are born to an environment lacking not only in expert medical personnel, but as well ill-equipped with a correct clinical knowledge base or an appreciation of the mode of disease transmission. Well-meaning but otherwise unsatisfactory care of the wound site leads to devastating and often irreversible events in the newborn period. In such cases, at time of delivery, the umbilical cord is cut with the mother's scissor, the father's pocket knife, a razor blade, or any of a wide variety of other sharp instruments that may be available, but certainly not sterile. Further, providing an ideal medium for infection, the baby's cord is tied with a piece of string found anywhere in the house and then covered with homemade remedies, many of which can lead to dreadful clinical outcomes. In my experience, I have seen families use henna, turmeric, sheep's spinal cord extract, charcoal ash, dough, lard, and many things unthinkable. These wounds are then covered with a few layers of old cloth and the baby is swaddled. The risk unknown to these loving and unfortunate parents is that these tours are too often contaminated with ubiquitous anaerobic gram-positive bacilli and its spores, Clostridium tetani. The wound site, the blood clot debris, and the wound covering all create an ideal environment for the anaerobic bacteria to grow. It follows that in nearly all cases of tetanus of the newborn, the umbilicus is the portal of entry for Clostridium tetani and its spores. Later, the second and third possible portals of entry are the penis status post-circumcision and the earlobe secondary to cosmetic piercing. Symptoms and signs of disease emerge once the neurotoxin of Clostridium tetani reach the brain through the ventral motor route. Incubation period in the majority of cases is about 1 week, but can be from 3 to 30 days. Muscular rigidity is the first sign in tetanus, and trismus is its most recognizable manifestation. Baby may cry excessively and refuse to eat, and any attempt to open her or his mouth will face severe resistance. Trismus or lockjaw can best be appreciated once an object is inserted into the patient's mouth, whether it is breast, bottle, pacifier, or a tongue blade. This cardinal sign is lost once and if the baby develops seizure and returns when the seizures have stopped. Despite trismus, the infant's mouth can be opened with a gentle pressure on the chin, but insertion of the tongue blade can precipitate trismus. The forehead wrinkles, tight lips, and vertical wrinkles on the chin create tetanus faces. Of the sights witnessed as a doctor, this is one that is very difficult to forget. Note the baby's sudden hyperreflexive reaction to each stimulus and the muscular rigidity which follows. Please note the cuts on the chest. These were supposed to let the wind or disease out of the child. A well-swaddled 5-day-old girl was born in a public bath where her mother was preparing herself for home delivery. Her cord was cut by a worker with a used razor blade. She had refused feeding for 1 day. Note the typical faces, the trismus on her lips and the clenched fingers. This 6-day-old boy was born at home with both grandmothers assisting his mother during childbirth. Note the cuts at the back of the hands to let out the so-called wind. This and similar practices in parts of the world are intended to create an opening in the skin through which the disease, or as they call it, wind, can leave the body. This boy was born in the taxi on the way to the hospital. The taxi driver cut his cord with a pocket knife. He was circumcised when 2 days old by a barber who boasted of having circumcised the child's father. Note the gangrenous penis in a well-sedated infant with tetanus. Often by the time these babies are seen, the cord may look normal and at times covered with mercurochrome. Convulsions are an ominous sign and can lead to aspiration pneumonia, apnea, and cardiac arrest. Tetanus, or arching of the back, can present at any time during the course of the disease and can be so severe to break the spine. Calorie malnutrition, or marasmus, is a common complication of tetanus of the newborn, since feeding these babies is very difficult and may lead to aspiration and pneumonia. Flexion of the wrist can be unilateral or bilateral, and mostly present during the 3rd week of illness. Prognosis depends on 2 main factors: 1, incubation period; 2, period of onset. Period of onset is the time between the first sign and the onset of convulsions. If the baby develops convulsions, not all babies have convulsions, and those who are saved of this notorious sign have a more favorable outcome. The shorter the incubation period and the shorter the period of onset, the worse the prognosis. The classical quiet dark rooms are unnecessary once the baby is well sedated. This is important since these infants cannot be well observed and monitored in a dark room in places lacking sophisticated neonatal intensive care units and the monitoring equipment they run. Treatment of tetanus of the newborn is very complicated, difficult, and expensive, with many disappointments. Prevention, on the other hand, is very easy, inexpensive, and guaranteed. To summarize, in tetanus of the newborn, we see a few-day-old baby who was most likely born at home or possibly in the hospital and was discharged home within hours without any comprehensive instructions in the care of the umbilicus. The baby is brought to medical attention for excessive crying and now refusal to feed, unable to take either breast or bottle. Parents might have succeeded spoon-feeding the baby a few times, but no more. Any attempt to open her or his mouth fails, and the harder a tongue blade is pressed, the more severely the lips stick together. Furthermore, any gentle touch to the baby causes a severe reaction and muscular rigidity. Tetanus and convulsions may soon follow. Flexion of the wrist or wrists may manifest during the 3rd week of illness. Aspiration pneumonia and apnea may eventually lead to cardiac arrest. The survivors seem to do well.